so delighted.
Please look into the camera.
With yours?
No.
Which one?
Yeah,
There are
just
three
straight.
cameras.
Yeah.
We are so delighted that Ghana is joining several countries that have introduced the vaccine, the HPV vaccine, into their routine programs. Ghana is among 28 countries in the WHO African region that will be introducing the vaccine, and among 140 countries globally that have introduced the vaccine. Why is this vaccine so important? It's because the burden of cervical cancer is high. It is the second most common cancer among women in Ghana, and globally it is the most common cancer that's affecting, the fourth most common cancer that is affecting women. And so we believe that with the introduction of the vaccine that we will be able to tackle a disease that brings a lot of suffering to girls and women, not just in Ghana but the region and the world. The vaccine is among a three-pronged strategy that WHO has worked with countries to develop, the cervical cancer elimination strategy that has been in place since 2020. The three-pronged strategy includes vaccination. We are aiming to reach at least 90% of girls by the age of 15 by 2030. The other approach is the screening. We aim to reach at least 70% of women by 35 and 45 years of age with screening services. And we also aim to reach at least 90% of women with precancerous lesions with treatment services by 2030. So this strategy is aiming for elimination of cervical cancer by 2030. I want to emphasize that is just one component, but we need to also in parallel promote early screening and also early treatment. In contexts like developing countries where access to screening as well as treatment facilities is limited, vaccination plays a very critical component. And so we are delighted that the opportunity is coming to Ghanaian girls, young girls, that next month, October 7th, the vaccine will be launched in a campaign approach for all girls between 9 to 14 years of age. And following that national campaign, we will have it introduced into the national immunization schedule targeting girls at 9 years of age. By introducing it in the national schedule, it means that all girls, regardless of their social demographic profile, will be able to receive this vaccine as we move forward, so that the future is secured for these girls as they enter that age bracket of high risk, and that they will receive this protection against HPV that is the most common cause of cervical cancer. There are several countries around the world that have been following this approach with good success. We have seen that with a combination of vaccination, early detection through screening, and early treatment, cancer is preventable and cancer is treatable. And so we have seen success. There are countries in the world that are not reporting cervical cancer cases or have reduced it to a minimum. That demonstrates that with a three-pronged approach, we can actually achieve our elimination target for 2030. So we are encouraging that and working with the government here as WHO to try and not only introduce the vaccine but also increase the capacities for detection, and also increase the capacities or access to treatment services. But we need to promote the three-pronged approach towards the elimination target of this vaccine. It is here to help to tackle an important public health problem. As I mentioned, it's the cervical cancer is the second leading cause of second leading cancer in Ghana. So by introducing the vaccine, we will be able to protect more girls and women and promote health for all in Ghana. So understand the benefits of the vaccine. And secondly, be advocates. Make sure that if you have a child in your home, or you have a girl that you know, a relative, a child of a friend, let us all be advocates to ensure that we have high turn-up, we have high acceptance for this vaccine. We would like to achieve high coverage with this opportunity that will avail itself in early October for us to protect girls. So be advocates. We also are relying on you to pass on the right messages. In such an era of misinformation and a lot of negative publicity, we need to promote and pass on the right messages about the vaccine. So be informed and pass on the right message about this vaccine. The vaccine is safe, the vaccine is effective, and the vaccine is here to protect our girls. So be advocates, be the channels of correct information for the public.
Children who were interested could get it, but now it's going to be available to girls from the 9 to 14 years for free, and that is really significant. And what it also means to us is that we are not expecting to see as many cases of the cervical cancer that we are seeing. We are not going to be seeing the kind of cases of cervical cancer, the anal cancers, and the mouth cancers that previously we were seeing, even the penile cancer. So it is a step forward, a step that is going to put us miles ahead in terms of prevention of cervical cancer. And so we are joining the many other countries who have already started vaccination for children against the human papillomavirus.
Doc, we know that session after the campaign.
This is the start of it here in terms of being part of our expanded program on immunization, where all the girls within those ages are going to be able to have it. Hopefully, as we pilot it, as we implement it, as the girls get it for free, many more people are going to be protected. And hopefully, in the future, the boys could be added on. But for now, they are not part. However, if we have many girls getting this immunization, somehow there will be herd immunity, and the boys will also be protected indirectly.
Please speak to it.
Just like the other vaccines that the expanded program on immunization gives to children across the country, the HPV vaccine is safe. It is also effective, or it works. It's not something that it does not work. It works, and so we are happy to recommend it for children. The other thing that people are sometimes concerned about, that this one, it will make the girls promiscuous. No, this is not something that we are giving to encourage promiscuity. It offers protection against the HPV virus and helps to prevent cervical cancers. However, our advocacy for ABC, so abstinence, being faithful to one partner, and then use of the condoms or the contraceptives, especially the barrier method, continues to be promoted. Okay, we do not want a girl who is 9 years to be having sex, a girl 14 years, 15, 16. No, we know that some do, but then that is not what we recommend. So this is to protect girls against having cervical cancers, which can kill them. And we want human beings to live, to be productive citizens of the country, and anything that can kill them and can be prevented should be stopped. It's also expensive to treat cancer, and so if we have a preventive measure that can prevent the cancer, then the government, the country also saves a lot of money in the process.
Look, at the individual,
I would prefer that it can be even before you make the diagnosis of cancer, you could be looking at about 5,000 Ghana cedis or much more, okay, to do the test and the other investigations that are needed. And treatment could be 100,000 Ghana cedis, much more. So the cost of treating cancer it's not cheap. Most importantly, if the person dies from something that could be preventable, no amount of money can bring that life back. And that is why we emphasize on prevention where prevention is possible. Not all cancers can be prevented. So if this one can be prevented, then
what are your recommendations to
work on that the vaccines will be available to young girls within the ages that have been mentioned, the 9 to 14 years, everywhere, so that access does not become a problem. Every girl anywhere in Ghana should be able to have access to the vaccine.
the government?